Hey guys, we're gonna work on something called scapula, which is your shoulder blade, retraction. So we're gonna do retraction, and there'll be another video for depression. So these are two things that a lot of people are missing. Their scapula should move in all different ways. So we should be able to elevate, protract, depress, and retract. And a lot of people struggle with this retraction and depression. So we're gonna do two videos on that. So this one's working on retraction. And what I'm gonna do is I'm actually creating a Pails and rails stretch. So I want you to really feel, so when we get into the position, you'll have my back to me, but I wanna show you, we're gonna have the wall, we're gonna use a corner. So you can use a wall, a rig, or something that you have that's immovable, something that does not move. You're gonna pop it on the shoulder, which is then gonna allow, as we push forward, our shoulder to retract. And I want you to let that scapula kind of come back till you feel the stretch through the tissue of the front here. It's not a pec stretch, it's more of a joint stretch across the shoulder and across into the scapula. So we're gonna find our end range by driving forward through the wall, letting the shoulder come back, and we're gonna then hold there for 2 minutes. I'm not gonna do full 2 minutes, a little bit boring to stand and watch that, but then we're gonna do 2 contractions. So our first contraction is you would solidify, and I'll talk you through this when we do it, your body and radiate, and then we're gonna drive our shoulder forward into the immovable objects, to the wall. So we shouldn't actually move forward, we just are gonna load everything we can forward. And the second contraction is gonna be rails, or try and pull off the wall, retracting the scapula, and that's where we're working on that regressive and retraction range, okay? So we'll set this up, just having any kind of wall, and you're gonna pop the wall just here. If you need, you can always add padding if that hurts or something like that, then whatever you're using, if it's a bar or a rig, then maybe you need a little bit of padding, like a towel or something, and just grab a rolled up t-shirt. So I'm gonna pop that there onto the edge of the wall, and all I'm gonna do is I'm gonna go forward towards the window while my shoulder stays there with the wall. You can slowly and little bit rotate to the left a little bit, but really it's mostly forward till you feel this passive stretch. So your right arm should be as relaxed as it can be, and then we're getting that stretch. This is where we hold for 2 full minutes. I'm gonna now do my Pails and rails. So I'm just gonna take a breath in. I'm gonna radiate tension in my whole body. I'm gonna solidify, and I want you to drive your shoulder. So I don't wanna move, but that shoulder drives into the wall, ramping it up 20, 40, 60, 80, greatest effort. So I'm not moving, that structure's not moving, but I'm trying to break that wall and move it away. Hold that for 15 seconds. 5, 4, 3, 2, 1. Rails, keep that irradiation tension and think about trying to pull off the wall. I don't want your body to move, I just want the shoulder to retract. So your scapula is retracting and pulling back, holding for 15 seconds. 5, 4, 3, 2, 1. Then we can stretch further. So a second set, we're gonna slowly load through that and let that come through, allowing that scapula shoulder to come backwards and retract. Repeat the Pails and rails. So a 2-minute stretch on a movable structure, so the corner, a wall, a door frame, whatever works, and let that tissue pull back. Then we're gonna hold that for 2 minutes. We're gonna then try and go forward or protract for 15 seconds, ramping up to our greatest effort. Then we're gonna retract for 15 seconds, greatest effort, repeat as much as you need to. Then one of the things, the best thing we can do is some scapula cars. So we're gonna come up, come forward, down, back. So once you open up a little bit of range, you wanna then, reversing here, you wanna just work that range. Our scapulas don't move